Hi, my name is Carolina Pavese. I'm one of the OB case managers here at the Culinary Health Fund, and this is
Talikia Gastonrow.
and she has participated in our OB case management program and also our healthy pregnancy program. And we're here to talk today a little bit about her experience with our program. So how did you first hear about our healthy pregnancy program and OB case management services?
I actually heard about it through my husband. He received a call from you, and then he relayed the message to me, and then we started talking from there.
What have been your experiences with the program?
My best experiences have been just the overall customer service and the sincerity of talking with you weekly, and just knowing me as a person. You consistently know who I am, what I'm carrying, the challenges that I go through, as well as the resources and the education that you give me when we're talking. I can take that to my doctors, my husband, and ask questions. It prepares me more, I believe.
And what has been the most beneficial part of the program?
I would have to say you. As a caseworker, I'm not sure what to call you. I'm
an OB case manager.
An OB case manager.
Yeah.
But I feel that we're friends. I don't feel that you're that. I feel that you're my friend. I feel that you'll be a person that I would call if I was to go into labor, if I was to have any difficulties, if I was to need anything, any additional advice, educational or resourceful resources. I feel as though I can count on you.
How do you feel these programs have impacted your pregnancy and prenatal care?
The book that you did send to me had things on the Braxton Hicks contractions. It had almost 2 chapters on it, and I experienced it. So when I was able to go to the hospital, I kind of knew what I was already having and the reason why I was having them for dehydration purposes.
What do you feel we could add or do differently?
Maybe have more books on twins, because it's so odd to carry twins. It's so unique.
It is.
Maybe that. I'm not sure. The program has helped me tremendously all the way around. And I don't know what programs are after the fact, but I would say nothing right now because this has been great. The experience has just been great.
Hello, my name is Lynn Jones. I'm a nurse case manager here at the Culinary Health Fund. I'm responsible for diabetics, dialysis, hypertensive, and chronic kidney disease patients. I'm here with a new diabetes patient. Her name is Sunita Villajoy, and she would like to tell you about her experience navigating her new diagnosis of diabetes. Sunita, how did you learn about our diabetes management program?
I actually heard about it through work. I work for Harris Entertainment, and there was a diabetic seminar being held at Paris. So I went there, attended it, and that's how I got information regarding culinary.
What has your experience been with the dialysis program?
It's been very positive and very informative. I found out about the culinary pharmacy and what they had to offer. I now know I can fill most of my prescriptions here at almost no cost. I also had you come with me to the doctor's office, which was great and very supportive. I found out that there was diabetes classes that were available to me, so very informative. I think it's been a really good experience.
How do you feel this program has impacted your health?
It was very overwhelming at the beginning, so you provided me with information, you provided me with the tools and the equipment that was available to me, so very helpful.
What has been the most beneficial part of the program?
It allowed me to develop a relationship with you, which is great for me, and I now have a support system, and if I do have any questions, there's someone to call, as well as your team members that are supportive.
What do you feel we could add or do differently in the program, Sunita?
I think just keep doing what you're doing, keep holding these seminars at the different properties for all the employees and making information as accessible as possible. Great.
Hi, my name is Zalia, and I'm 12 years old. I was diagnosed with diabetes August 2nd, 2010. And when I learned about it, it was hard because I didn't really know about it. And I know it's hard for other children, but they shouldn't be scared because there's other people there for them. And
And how did you learn about the diabetes program here?
Well, I learned about it because people went to the hospital and they visited me there and they told me about it. They told me about the diabetes program.
Great. And you say people, were those people doctors or nurses? Or?
Yeah, the doctors went to and told me about it.
Great. And the nurse too?
Yeah.
Great. And then what do you like most about the program so far that you've been in?
What I like about the program is that they teach me more about it, and now I know things I never knew before.
Great. Like what, for example?
I know, like, to not be scared because there's people there for me, and, like, now I know how much insulin to put when I exercise and when I eat.
Great. And what do you think would help other people who have diabetes that are brand new for them? What do you think would help them to know?
Well, I think things that would help other people with diabetes is like putting them all together and we could all talk about it.
Great.
And we'll all learn more.
Great. So just kind of support each other. Great.
Yeah.
And what do you think for children is the most important thing that would help them?
The thing that would help them is to talk with their parents and like to not be scared to tell them stuff.
Great, great. And what do you think is the most difficult thing because you're in school that makes managing your diabetes challenging?
What's difficult in school is that when I'm in lunch, I have to eat faster because we only have 30 minutes to eat and then I have to go to a nurse's office and sometimes I get late to classes.
Right. So it's organizing your time all day long. Great. Good. Is there anything else that you want to tell us about having diabetes that might help someone else?
No.
Great. Well, thank you very much. We appreciate it.